Hi, and welcome to the channel. You've probably clicked on this video because you wanted to know whether you have liver problems or not, right? So, to clear your confusion, we'll be exactly discussing the liver problems in today's video. Many times you may have noticed that there is something wrong with your liver, but you can't get that problem at first and you ignore it. But remember, these mild problems can lead to serious life-threatening conditions. That's why all health specialists advise paying full attention to your body organs, especially the liver, because it is the essential organ where digestion of food and elimination of toxic substances takes place. Now, the main question is, how do you find out that you have liver problems? The answer to this question lies in only one thing, and that is the symptoms. Symptoms are an indication of your future threats, and you can easily figure out any problem if you have its symptoms. So, let's quickly find out the symptoms of liver problems. Liver problems get worse over time and can cause major damages to your body, if not handled at the early stages. Now, the first symptom you may encounter in liver problems is a change in your skin and eyes color. A person having liver problems will have yellowish skin and eyes color, and this yellowing of skin and eyes leads to a condition known as jaundice. An orange-yellow bile pigment called bilirubin starts producing more than its normal value and causes jaundice, which then turns your skin color, whites of the eye, and mucous membrane yellow. Many people consider jaundice a disease, but it's not a disease itself. It's a symptom or cause of liver diseases. And if it reaches in a serious phase, then it can block your bile duct, and doctors recommend surgery to open it. Furthermore, it usually doesn't treat in adults, so it is important to pay attention to your liver problems. Now, it's not that if you only have jaundice, then you'll be a liver patient. There might be some other symptoms associated with liver problems, like itchiness in your skin, dark urine color, vomiting, nausea, abdominal pain, and swelling in the body. Loss of appetite is also a major symptom that you have become a victim of liver problems. Now, at this point, I'm quite sure that you will be able to answer the question we've discussed earlier, that how to find out whether you have liver problems or not. And you can easily figure out such problems with the help of the symptoms discussed above. Now, let's look at some bigger aspects. You've carefully read all the symptoms, right? And what if you have these symptoms? What to do now? Don't panic, as I'm going to answer all the queries in this video. The first and easiest step for this is conducting blood tests. All doctors advise liver patients to conduct blood tests, especially liver function tests. These tests are the best way to diagnose even smaller problems and malfunctions in your body. These tests will determine the cause of your liver problems and will help the doctors in doing a thorough physical examination. A liver function test, sometimes known as chemistries, is performed to check the state and health of your liver. This test diagnoses the major problems in the liver by measuring the protein level, liver enzymes, bilirubin level, and the prothrombin levels in your blood. Doctors generally recommend this test to people suffering from liver failures, hepatitis B and C, anemia, high triglycerides, or gallbladder diseases. This test is also performed to find out if a certain person has become a victim of liver problems or not. And if yes, then what are its causative agents, and how can this disease be cured? Besides liver function tests, alanine transaminase, aspartate aminotransferase, alkaline phosphatase, albumin, and bilirubin are some other worth performing tests for liver problems. What these tests do is measure the enzymes released from your liver, and each of these tests has a very specific function. Like if you look at the name of these tests, they are explaining their work themselves. Such as bilirubin test is done to check the level of bilirubin pigment in your blood. Similarly, albumin is a protein that measures how much this albumin protein is producing in your body, and thus maintains its normal range by transporting hormones, vitamins, and other substances in the body. So, each of these tests is specified for a particular liver problem. But here's one thing you should know, that these tests are for acute liver problems. Suppose a person has serious liver infections, then health specialists will recommend him for imaging tests. Imaging tests may include ultrasonic tests, MRI, CT scanning, and ultrasound. These are some advanced type of tests that monitor major liver diseases and find solutions to liver problems with the help of technology and machines. Like if we talk about magnetic resonance imaging, then it detects liver problems by providing information about the blood capillaries and blood vessel disorders. And as you can see from the name of this test, its major benefit is imaging means it provides clear and high quality images of the bile ducts and other close structures. Similarly, the ultrasound technique is the use of technology and machines to identify the cause of liver problems. Along with these discussed treatments, there is another method to treat liver problems called a biopsy. It is usually done when patients are in a serious stage of liver failure. So, what happens in a biopsy is doctors cut out a part of the damaged organ and take it out from the body for detailed study and observation about the disease. As that part is taken from the damaged portion, so it will have all the causative agents that are present in the whole organ. Doctors may call it a lesion or tumor formed in the body. Also, it is a more effective method of treatment as it involves close and detailed observation about the disease and malfunctions happening in the body. Discuss the symptoms, discuss the treatment, right? But one thing that we haven't talked about is the causative agents of liver problems. And this is the most important thing I would say, and why I'm giving it the title of the most important thing, because if you know the cause that produces liver problems, you can avoid them easily. When a person is well aware of the causes of a certain problem, he would be in a perfect state to avoid these problems, as he knows its causative agents. So, if we talk about the causes of liver problems, they may vary according to the conditions, like they may be genetic and environmental. Genetic causes, are inherited from parents to offspring through the transfer of genes in them. To understand it better, let's say a mother is suffering from hepatitis or liver failure during her pregnancy. Doesn't she also transfer it to the child? Of course. Because the child is dependent on his mother for food and nourishment. He will intake the same protein and vitamins as are present in his mother's blood. So, genetic causes are a major factor that induces serious liver problems leading to failure of the liver or nearby structures. Now, if you're lucky to not have genetically induced liver problems, then you might fall victim to environmental causes. And one of the drastic environmental causes is drinking too much alcohol. Overdose of alcohol hits directly to your liver and causes serious problems leading to cirrhosis, which then causes hepatitis B and C. If you're now thinking that you're safe because you don't drink alcohol, then you're wrong, because over-medication can also cause serious liver problems like cirrhosis. If you are a person that needs too many sleeping pills or headache medicines, or medicines rich in acetaminophen, then there's a high chance of liver diseases attacking your body. Accumulation of extra fat in your body, especially in the liver, is also a major environmental cause of many liver problems, as too much fat can destroy your liver cells and form scars in the body, leading to cirrhosis. So, that was all about liver problems, their symptoms, preventative measures, and causes. I'm pretty much sure that all your confusions related to liver problems are now clear and you have found this video helpful. If you do so, let me know by hitting the like button and subscribing to this channel. And if you have any queries, please share your thoughts and experiences in the comments below, and I'll make sure to answer that. Do enjoy your day, and I'll catch you in another video with some interesting information for you. Bye for now. Thank you.